uh, any more to log in. We have a very full agenda today. I want to begin by just asking all the panelists if you could mute your phones. That would be helpful. We have the phones muted for all of the other individuals who are on the call. So again, every week we want to just kind of huddle up and talk about where we are as a community as it relates to preventing the spread of COVID-19. We also want to continue to organize as a community to ensure that our most vulnerable populations are, that their needs are being met. And so today, I just want to go over the format of the call, and we'll go over the agenda, and then we're going to jump right in. We're expecting this webinar to probably go a little bit longer because we have quite a few people who are on the agenda today, but no more than 90 minutes. You can use the chat button to ask questions, and if you're having difficulty logging on, I would encourage you to log off and use Google Chrome. This WebEx application works much better with Google Chrome. If you're working from home, just please make sure that if you're a panelist, that is, that you have the mute button on. As I mentioned, we've muted all of the other participants. And just remember that this webinar will be recorded. All of the webinars are recorded and they're placed online at pbcgov. It's actually .com/community services. So feel free to go there to see some of the previous webinars as well. For our agenda today, I just want to welcome you, but we're gonna hear from Julia at Career Source first, because she's gonna have to jump off the call soon thereafter. And we always want to make sure that we're keeping our finger on the pulse of what's going on. We are expecting a surge of people who are unemployed, and we just want to be prepared to work with those individuals to minimize the amount of time that they are unemployed and really work together as a community to lift them up. We'll then go into our update with Dr. Alonso, just looking at some of our numbers and giving you the latest data as it relates to COVID-19. We'll then hear from the Department of Children and Families, from the child welfare, and just some basic general information about what's happening there, some of the benefits and waivers around SNAPs and food benefits. And then we're going to hear a little bit around what's happening in the domestic violence realm. And then if June was able to make the call, hopefully she's on by then, or she's on now. We want to hear from the district, just a little bit about how this transition to the online learning platform is working and what we can do as a community to support them. And then if there's time left, we'll give you very quick updates on what's happening with basic emergency services. I'll ask Taruna if she's able to stay on for that amount of time to share some things that's happening within community services. Then we'll hear from our other partners, starting with Julie Kriefel, if she's able to join us today, and then we'll hear from others as well. I'm not going to spend a lot of time on this. I always like to bring us back to why we are here, though, and how we're kind of operating. I've been at the Emergency Operations Center for the past, I'm going on week 5 now. And so part of my role as the Human Services Branch Director is just to make sure that we're organized as a community to be able to manage and recover from any disasters or things that we encounter. And obviously, this is something just very unusual for all of us. And so we're learning a lot, we're documenting a lot, and we're, I think, making a lot of progress in terms of managing this disease and getting testing done, which you'll hear a little bit more when Dr. Alonso presents. So with that said, I'll turn it over to Julia. If you can unmute your phone and go ahead and provide some updates. You know, Julia asked me not to put any slides up in fashion. you know, I found a slide or so that I definitely wanted to make sure that you guys were hearing about. This is from a website, but Julia, you can take it from here and then we'll transition to Dr. Alonso.
All right, thank you so much, James, and quite a panel today. I'm sorry to have to miss it and jump off and take another call, but I wanted to share some information and build on the information that I provided in the previous weeks. So to start, the Department of Economic Opportunity Reemployment Assistance Program, Connect, is up and running, and it is tenuous. However, they are now closing it every evening to provide updates and upgrade the system. So from 7 p.m. to 8 a.m., it is down. And in the daytime, it is becoming more efficient and more fluid. On top of that, don't forget, we are now offering the paper applications for reemployment assistance, and they are offered in 3 languages, Creole, Spanish, and English. They can be found at the public libraries as well as the front doors of the career centers. Those paper applications can be filled out and mailed to the Department of Economic Opportunity in Tallahassee, and FedEx offices are actually collecting them and mailing them for free if you need assistance with that as well. So while CareerSource is not the Department of Economic Opportunity and we have no control over the Connect system, we have mobilized our staff to assist our community in answering questions for those applications and for online assistance. We have answered thousands of phone calls and answered thousands of emails and put in a lot of hours to help our local residents. So we have compiled the frequently asked questions, and we have put the information and any questions you might have onto our website, which is careersourcepbc.com, for not only the job seekers, but for businesses and for people trying to apply for reemployment assistance. But I caution you, there are scams out there right now who are people calling homes and businesses saying, we can help you with your applications. Don't fall for those scams. The fraud alert, thank you very much, James, for putting that up. The Inspector General put this fraud alert out just this morning. People are asking for credit card numbers, social security numbers. Please know that the services are free. You do not have to pay for reemployment assistance. In the end, you get paid. So please be smart and be safe when answering phone calls such as those. We can help you at CareerSource if you have questions. The applications are easy to fill out and mail in, so please do not fall for these scams. So while we're helping our Palm Beach County residents apply for relief, we're also helping businesses. We want to help not only relieve, but now restart our work in Palm Beach County. Our critical work sectors, hospitality, retail, restaurants, and even now we're seeing healthcare workers and car dealerships and other businesses furloughing or laying off their staff. Through partnerships with municipalities, the Business Development Board, the economic industries, and associations, we are all working together to come up with plans to restart our community. CareerSource has joined a task force with Discover of the Palm Beaches, FAU, Coulter Hospitality, the Florida Restaurant Association, to really formulate a plan. So when Dr. Alonso, the next speaker, and our county say it's safe enough to venture out and to start to reopen, that plan is already in place. That we know which hotels will be rehiring and when, and which employees they'll be rehiring. So we're diligently working with our community and our businesses to try to plan for the reopening. Now, in the meantime, we're also helping businesses with their reemployment opportunity grants. We're not actually providing the grants, but if we have information for them, that is also on our website. We have new job seekers registering every single day looking for employment. So if businesses need to stay open, need new employees, we are there to help those businesses too and help you with your hiring opportunities. CareerSource itself on our website, employflorida.com, has 498 jobs available and open. We're looking for CNAs, certified nursing assistants, coding and billers, call center help personnel, anybody who has a CDL license or works in construction, delivery services. Those are all jobs that are available in our community. As a matter of fact, you can drive around our community, you see signs up saying help wanted, go for it. Whatever can help you, we are here to help. Our website, careersourcepbc.com, is where you'll find the facts for employees, for job seekers, for businesses, and for frequently asked questions and reemployment assistance. And lastly, we're learning from everybody and how they're working with their successes. And that is pretty much taking your business and going virtual. So we are trying our very, very first virtual career fair with the thanks of the Boca Raton Innovation Campus, Premier Virtual, and South Florida Tech. We are doing a Tech Career Expo on April 22nd. It is a virtual career fair, which will be open from 8 a.m. to 8 p.m. You can apply for jobs and talk to employers in the comfort of your own home and on your phone. So we encourage you to take a look at that. To apply, it is free, again, at no cost to the job seeker. So that information is also on our webpage, careersourcepvc.com. So we kind of took all that information and put it together for you on our own webpage. And I do hope that that helps you right now. So thank you very much, James.
Thank you. Thank you. Are we still seeing the same rate of unemployment claims for Palm Beach County?
Well, we're sitting at around 19,000 applications at this point in time, but the number is not going to be accurate because those were the online applications. And now with the paper applications and not having them all processed, we really don't have a good grasp on that number, but it is going up every single day. And the new job numbers will be out tomorrow, so be surprised to see a much higher unemployment rate. It is a spike when season opens up and when this is all over and we get the all clear and we open up in phases, that number will come down, but we will see a spike in unemployment.
And we're going to hear from the Economic Self-Sufficiency arm of DCF after Dr. Alonzo's presentation. Do those individuals who come in for unemployment or reemployment rather, do they get information about how they can enroll in SNAP benefits and things of that nature?
They will have to apply, sure, absolutely, but they will have to apply for their SNAP benefits through DCF, not through CareerSource. CareerSource just monitors their compliance with the program.
Okay, and I know the one-stop shop concept would facilitate that, but we're not all coming together. It's not in one center. They're not coming in, they're applying online. So just thinking about ways to have a more integrated service approach, especially for some of the supports that these families will need.
Correct. We have the SNAP department within CareerSource. Absolutely, we can help with that. But for them to come to us, they really have to apply through DCF first.
Okay, and DCF might be able to answer this question as well, but do they get the $600 for, I think is that for SNAP benefits?
No, that's the
unemployment. For unemployment benefits, do you know if they get the $600 weekly or do they have to apply separately?
Do you get that when you apply for when you file your unemployment? Does the $600 additional weekly come automatically, or does that come as a separate, do you have to do a separate application for that?
Once your to the best of my knowledge, once your application is in and you're eligible for it based on your income, that will be automatically deposited in your bank account as well.
Okay.
That is dependent on you filing taxes. It depends on your income and other things.
Yes, of course, if you qualify for it, absolutely. Okay, that clears it up. I've been asked that question many times and I thought that was the answer, but I wasn't sure.
Yeah, it has no relationship to do with SNAP or anything like that. It has to do with your unemployment, your tax ID, and your availability to have paid taxes and your eligibility for it.
All right, thank you very much, Julia.
Pleasure.
All right, we're going to turn it over to Dr. Alonzo and let her take it from there.
Okay, let's see if I learn how to do this thing finally or not. So the first thing we're going to take a look at is our number of cases in Florida, which is 22,897 right here. You see the hospitalizations have climbed to over 3,000 with 633 deaths. So we had a very interesting conversation with the medical examiner today in terms of our number of cases, which is 1,841. And we have right now 110 deaths. She mentioned that 110 deaths are almost all exclusively people dying with COVID as the main diagnosis. These are not people that fell off the roof and then happen to test positive for COVID. They're actually dying as a result of the COVID. So I think that is very revealing to all of us. And it's all in the elderly population. I think we have some more stats on you for that. So you can see here that the male and female ratio are pretty much the same right now. The females have started to overtake the guys. I knew they would catch up. They always do. In terms of our distribution of cases, this is a little misleading because even though we have had some deaths here in the early ages, 92% are between here and here. Okay. This is, as a matter of fact, we had a 104-year-old that died not too long ago. So that means that the average age is going to be above 78 when we take that number into account. This other graph here shows our daily new cases. I think this is what is important. It's not the total number, but the new cases. To me, an epi graph, usually a normal epi curve goes something like this, goes up and then it comes down. So very high and then it comes down. We have not done that. And I think that's because we began early social distancing. We were able to have this kind of flat raising, but flip flat. I think we had a high here. And then to me, maybe it's just I'm being very optimistic. To me, this looks like a little flattened curve that we want to do. These two outliers here are when we had a big number of tests coming in because they had been backlogged. And now the governor announced that they have to be electronically reported to us. So this is what happened on Easter Sunday. I woke up to this big spike and I was like, uh-oh, we're in trouble. But it was due to a huge dump of about 3 weeks worth of laboratories. So this was 172. We rapidly came down to 55, 56, 47, and this last one was about 70 cases or so. So while we are seeing these few little irregular bumps along the line, if you take the curve, it looks like we do have a small curve. So what are we waiting to see or not see? We're waiting to see if this is going to go up further or if we've actually going to continue to see this going down. So that is what we have to keep hoping and praying for. If we pray, keep making this go down. This tells us about our testing. We can click on the individual county. As you can see, our dots are much smaller than Miami and Broward. They have tested double, triple the amount that we have. However, our numbers have remained steady. And we have 11,729 tests that we've done now with 1,841 positive tests. Of course, the majority are negative. This gives us a 15.8% positivity rate. This is higher than Broward and Miami, and that's because they have a lot more testing done. The more tests you have of negative people, this number goes down. We've been very specifically testing people who have symptoms. So we expect this to be higher than Broward and Miami. Now we're relaxing that criteria a little bit, and we're going to probably see some of that coming down. These are the COVID positive tests that we have. And you can look at this and see the darker areas are where we have the higher numbers. So West Palm Beach, this whole area, and this area is actually where the north testing site is. That's the baseball park. So this whole area of people here have been getting quite a bit of testing. What we did is we took this map, which is, I believe this one's by zip codes, and we turned it into the number of cases per zip code and the population. When you take a look at that, the areas that are significant are a few down here in the Boca Del Rey areas and a few hot spots here in West Palm Beach. with 0.3% of the population testing positive. Now remember, we only have 15% of the population overall, so that makes sense. And in these little areas, the percent of the population is less than that 15. That is correct. But what we're looking at now is how do we then start testing, because this site and this site are both drive-throughs, right? So people that can't drive through, that can't get to these sites, aren't being tested. The one out in Belle Glade shows 0 here because of the numbers that they're looking here. They have about 22 cases out in Belle Glade. If you take the population, which includes South Bay, Belle Glade, that's less than 0.1% of the population testing positive. Pahokee has its own number, and they're less than 5, so that's negligible. What we want to see now is how do we get to those folks who either have to go by bus or other transportation that they cannot go through the drive-through. So there are several ideas in play right now that we're going to work with these vulnerable populations and making sure that we can get to them. We have a couple different ideas of how we either get to them home by home or have them be able to come to us at certain areas where they would be within the bus routes and so forth. So there's several options available for that as we go forward for next week. This is important also. We've talked a lot about the racial ethnicity. Our big problem is this number right here, the unknown race. But as you can see, in terms of death, it's only 50%. If we take a look at our numbers, the largest number is this. Can we get rid of this? I hate when I do that.
You can see it from there, though.
Oh, yes, I can see it from here. Get rid of me. I can't stand when I see that. I look like Stevie Wonder or somebody. I did that at a television station once. There?
No, the other one.
Here?
To the left.
To the left.
Yeah.
Oh, okay, it's gone. Yay. Okay, so if we look at the population here and you see the white, that's 67%. That 67% is 17% Hispanic whites and 47% non-Hispanic whites. When you go into the Black population, that's only 18%. And when you look at other, you have a few Hispanics, but very small, 2% non-Hispanic, and some other ethnicity. If you take this unknown number, let's say you made it all Black, that's 8%. So if all of these were to be Black, you add that to this Black population, right? You get 27%. So even adding those numbers, whether it's Black or Hispanic, is not going to be greater than the white non-Hispanic numbers. Does everybody understand what I'm saying there? So in other words, if I add that 26, it's less than the 47 white non-Hispanic. Okay? Now, we will get to these numbers in terms of right here, this unknown. What I'm having my staff doing is going paper by paper for all these labs that are coming in from the commercial labs and taking then our Merlin system and looking to see at race, ethnicity, and any other demographics that we may have on that. So we will get to that, but it's going to take us a little bit of time because we have to manually go through that. But that's what I've tasked one of my EPI people to do so that I can give you a better picture of what this actually looks like. So we will get there. It just takes us a little bit of time because it's not being done electronically. Are there any questions?
Yeah, there were a couple of questions. You have to expand it. Go to the top here. And
Chat. Okay. So is it true that anyone can get tested now, meaning you don't have to have symptoms? Yes and no. What we've done is the baseball park has eased their questions. They are asking, they're allowing anybody that has a concern to get tested. But they will ask you, have you come in contact with anybody? Do you have any concerns why you want to get tested? They want to know what's the reason for you wanting to get tested. So hopefully it'll be, I've come in contact with somebody in the past 10 days. If you say, I just came in contact with somebody yesterday, they won't test you because you don't have enough time to have created antibodies. I'm sorry, I said the wrong word. I take it back, rewind. You don't have enough time to create viral load in your blood that's what the test picks up right now, the viral load. So if you've just come in contact with somebody, you do not have enough time to make enough virus for the test to come back positive. In which case, you would have a false negative and you would walk away thinking you're fine and you're not. So the answer to that, is it true that anyone can get tested now? It's technically yes. Now, on the south end, they are taking people above the age of 16. Nobody wants to test the younger kids. They are still asking for appointments. Both sites are still asking for appointments. And we're trying to get the south side to do the same thing. They're still asking for some symptoms on the south end, but we're trying to work to see that they do it the same way so that both sites are the same. The site out in Belle Glade they have 2 doctors on site. No appointment is needed, and they will take anybody that has concerns in terms of getting tested, just like the baseball site. And so the last question from Marcia, thank you for asking that. Our racial breakdown. Marcia, do you have any other questions in terms of what I showed you here? I know you're on chat only, but if you have a question, go ahead and ask it. And does this breakdown help you with what you're trying to look at? I think we're all trying to look at the same thing, but I just want to make sure. If you see that we need anything else, let me know and we will try to get that for you.
And you can unmute too, Marcia, if you need to. You have a couple more slides.
Okay, this one is our breakdown. Again, like I said, if you look here, this number is 92%, or at least it was the other day. Yes, it's still 92%. So really, the cases over the age of 55, 23% for 65 to 74, 33% for over 84 years old, 75 to 84. And now we have one that's 104. So, you know, these are the really big numbers. These are the people that are dying. These are the people that are very vulnerable. They have multiple comorbidities. So when people say age 65, stay home, this is why we're saying that. But I don't think it's so much the age as it is what else is going on. I'm sure there are people here that have died that had other comorbidities. And there are plenty of 65-year-olds, I'm almost there, almost 65, that are just fine and they're not going to die even if they got it. So it's not the number, of years, but this is our big concern. And that's why our nursing homes, our ALFs, we're checking on them daily. We're going out to visit them because those are the people that are going to get in trouble really, really fast. And we have to make sure that we keep a very close eye on them because that's very quickly can give us a big cluster. Okay.
And there's one more.
Yeah, this is pretty much what I just said. We are still researching the rapid test. I found out today I got a call from the governor's office that the problem they're having with the rapid testing, which is the approved, one of the lab companies, is that their machine is not working and they can't verify the tests. The tests are not coming out right. So They're working on those. There are a couple, St. Mary's has a rapid test for the patients that they have that are coming in, the critical patients, they're doing a rapid test on them. And we're looking at being able to get that. We're the only health department in the state that has a lab. And so we're looking at being able to do this also here locally. If we do, we would open that up. We have to see how that tests out with our equipment. I've been talking with the governor's office about this. So if we can do it, we will open it. We will open up to the public. The criteria has been relaxed, and this is correct about Belle Glade, no appointments necessary. They're talking about having, in addition to the walk-up, they're gonna perhaps put a drive-through also so that they can get both drive-through and walk-ins. And so our big question is being able to get transportation for those who are either homeless or that they are shut in or whatever the situation is. So we need to go out to them to get tested. How do we do that? What's the best mechanism? What would be the most effective? So we're working on that. Why do I think that the number of children infected is so low? There's something going on with this virus that is different than other viruses. And it has something to do with our immune system. Children have a lower immune system than others. And for some reason, kids can be positive, but they're completely asymptomatic. So that's a good thing. And we're very happy about that because obviously that was one of the things that was killing a lot of kids with H1N1. We don't have that problem here. So that's just something that we've been very fortunate to see this occur. And we're happy for that. How will institute contact tracing? Is there a cost for the test? If so, do we know the cost? In terms of the testing, if we do the testing, it would not cost. Right now, none of the two sites are charging. This was an agreement that was done in order for them to do this, that they would not charge. Obviously, the healthcare district is never charged. We would not be charging at this point. If we're getting the tests for free, we obviously wouldn't be charging. That's part of the deal of getting it from the governor's office. In the future, they will charge your insurance if you have insurance. If you don't have insurance, then we obviously can't charge. So I'm not sure how we'll institute contact tracing. Maybe you're talking about the nursing homes.
They're talking about the monitoring. How do you monitor? How do you Epi?
Oh, Epi goes out, and every single positive test, we have to contact that person. We talk to them on the phone. Sometimes we have to go to their house, and we ask them, just like we do for STD. We ask them who all the people are that they were in close contact going back a certain number of days for the incubation period, which is 14 days total. Usually 7 days before you start having symptoms, and then the 7 days after. So we take all that into consideration. It's a very lengthy questionnaire that we have to go through. It's like 3 or 4 pages. We ask all that information, and then to each one of those people, we have to make a determination whether they have to quarantine for 14 days, look for symptoms, or if they have to go out and get tested if they already have symptoms. So it's quite complex. And that determines who has to stay out of work and who doesn't. So we do that with the fire rescue, we do that with law enforcement, and any employees that become sick. Each organization has a contact, in all our ESFs here, each person has a contact that is handling the people that we have to send for testing in terms of law enforcement and fire rescue or healthcare workers, so that we know how long they have to stay in quarantine.
Can you talk about what things that are the major things we would have to consider before reopening? I think you mentioned it earlier.
One of the very important things that we have to consider before we're ready to open and get back to what a normal would be is the ability to test sufficient people so that we really have a handle on who's positive and who's negative. The ability to do rapid testing so doctors' offices can test individuals. And the ability to look at antibodies so that we know who is actually protected from the virus. Not only now, but remember, this is going to come back next winter, and we have to be ready then to take this on again. So knowing at that time who was positive in the past and has antibodies for probably at least 2 or 3 years, or maybe even more, would be very important for people that could actually be working on the front lines and not being afraid of being becoming positive. So that will be a huge help for first responders, for healthcare workers, really for anybody involved in this that has to be in contact with the public. So that those antibody tests are something else that's going to be very, and that is all going to be blood tests. So again, that is something that's going to be very helpful for all of us, and that we definitely want to be able to have access to that.
And do you have any insight in terms of where they are with finding a vaccine for?
The vaccine, usually the vaccine takes 2 to 3 years. It would be great to be able to have the vaccine for the next round come November, which is when I expect this to raise its ugly head again. I am hopeful because the vaccine has already begun working in Canada and in other places, and actually people are being allowed to take the vaccine. They're actually volunteering to do this. If they offered it around here, I'd volunteer to do it too. So the vaccine will be a very, very useful tool, and that would be something else that would allow us to get back to normal, because then we can vaccinate the majority of the population. And I got a feeling that even people that are afraid of taking the flu will take the coronavirus vaccine. Okay.
All right, we're going to take this last question, and then we got to keep it.
Yeah.
Moving.
How effective is releasing positive person from Palms West Hospital and telling them to self-quarantine at home? How often is the health department following up on these patients? That is how all patients are being. If a person is not severe enough to stay in the hospital, if they're not on a ventilator, basically, or needing support organ support, they will be discharged back home. That is the normal since this has started. Is that effective? Yes, it is, because you don't want to tie up hospital beds unless they are absolutely necessary. In order to keep a person in the hospital, you have to justify why they're in the hospital. If the person can be released back home, then that's where they should be.
And the CDC has issued guidelines on how to self-isolate at home. We make sure that they have that.
Yeah. And if a person is just being quarantined at home, we're not following up on them. We're only following up on new cases.
All right, thank you. Thank you very much, Dr. Alonso. And I see there was a question about data from Palm Beach County. We just went over all the data. This information will be posted online at pbcgov.com/community services. So if you'd like to get a recording and see the data for Palm Beach County, you can go there, or you can go to the Department of Health, Florida Department of Health's website, where all of the data is shown as well. So now we're going to hear from DCF, but we're going to hear from a couple of people, from Larry, who's over ChowNet. So he's just going to give us kind of a general overview. And then I have Robert Shea, and a name that's not up there is Patty Grogan, I believe. So they're going to just give us some information about, I know you guys have been hearing about this online grocery store and some expansion of SNAP benefits and other things. And so we're going to have them share information about that. And then we're going to hear from Jennifer Ray. She's going to talk a little bit about domestic violence and what's happening in that space. And then we'll be ready for any other updates from the community. So Larry, if you can unmute yourself and take it from here.
Looked like I was unmuted. Am I unmuted?
You're good.
Okay, thanks, James. So The system of foster care and related services in Palm Beach County is clearly an essential business, and we are up and running, as are all our network providers, albeit under very different circumstances. We are still seeing children and families. We're actually seeing them more frequently than we normally would, or more frequently than Florida statute requires, but we're doing the bulk of those visits and those interactions with children and their families via video platforms like this. So Florida statute requires seeing children in foster care once a month. We are now seeing all children in foster care in Palm Beach once a week. Most of them, however, again by video, but there are 6 categories of children among the 1,700 foster care children in Palm Beach that we've reviewed their cases, think that safety concerns with them are sufficient, that we are also making the monthly in-home face-to-face visit with those children. Court cases are proceeding. The 15th Circuit Judicial Court has been fantastic in accommodating and still moving things forward, holding all the sorts of cases they can, except for contended trials, to be sure that we don't get too backlogged in the current system of foster care because we're not moving kids and cases through the court system. So on those levels, things are moving really as well as they possibly could, I think. The other good thing is our numbers remain relatively low. Our biggest fear really is that if we have an increase in the number of children being removed from their homes, we won't have the capacity to care for them in terms of foster homes or even group homes and shelters, as adults either are reluctant to take children into their home who might be positive or have been exposed, or as our residential group care providers and shelter care providers or our foster parents become ill themselves and are incapable of caring for children. The good news is that we haven't had an increase in the number of children in care. Right now, we are a little bit lower than we had previously been. Regrettably, for the last year and a half or so, we've been at the highest number of children in foster care in quite a while. Over the last 4 or 5 months, however, that number has slowly come down. So right now we're about 1,670 children this morning in foster care in Palm Beach County, down from about 1,720 a couple of months ago. But that decrease is not related really to the virus in any way, shape, or form. It is really because we've increased the services and access to services for families so that PIs, protective investigators, haven't had to make as many referrals over the last 5 months. So our census things remain under control, but we are worried about should there be a bevy of new cases coming in, especially kids that are infected, whether or not we'll have the capacity. Right now we're getting by, and we continue to try to increase that capacity with licensing new homes, and we are still licensing new homes. And as far as children with the virus, and that's why I asked Dr. Alonso the question, we have only seen so far 1 child in Palm Beach County in our system among those 1,700 kids that has tested positive. That was a child in the home of a non-relative caregiver. And that child, I believe, remained essentially asymptomatic and is fine. That is the only child that so far has been identified and tested positive among our 1,700 kids. We've only had.
I want to know how old the child, you know?
I'm not positive. I'm thinking like 9, but I'm not 100% sure.
Okay, we know which one that is. That's good. Yeah,
Okay.
and that's true nationally.
Yeah, and that is reassuring. We have only had, amazingly, 1 caregiver so far test positive, and I believe that was the non-relative caregiver of the child who tested positive. Our challenge right now is a little bit of concern about staff that test positive. So far, of our subcontracted staff and ChildNet staff, there have only been 3 positive tests. One was a case manager at CHS, and 2, and this is what gives us the scare, 2 were workers at our intake and assessment center, Safe Place, which is at our building in Okeechobee Boulevard. And when the second one tested positive, the health district recommended that all of those employees who had come in contact and had direct contact with those 2 positive staff members should now self-quarantine. And so what that in essence did was pretty much wipe out the availability of our entire full-time subcontracted intake and placement staff or assessment staff at Safe Place. We were threatened, therefore, with perhaps having to close down the night before last. However, we were able to get sort of volunteers, actually ChildNet staff from both counties, who stepped up and are taking over some of the shifts at Safe Place, and then some part-time staff from 4Kids is still available because they hadn't had contact with the positive employees. But clearly, if a similar thing happens at a group home or shelter, it is going to be a challenge, and that is probably our biggest challenge at the moment, or our biggest fear.
Larry, so that would be the health department that gave you that advice. That's what we do, not the healthcare district. So
Sorry.
We have to think in terms of prevention here, right? So if the staff had been maintaining social distancing, this would not have been a problem. So we need to keep, just like we're trying to do here, so we got to stay that 6-foot distance. If we have folks that are on top of each other, then all that staff will go down with that one person.
Right.
We
And
also, the use of facial coverings is another one that would be very important. If people were using facial coverings, then that staff would not have to wiped out. So we need to think of ways to prevent and assume that everybody around you is positive. That's the only way we're going to beat this and make sure that that doesn't happen. I have the same problem at work with WIC. We had a situation where a person actually had a boyfriend, and she took him to the hospital, and 2 days before she had come to work and she was coughing and having a fever. Why would somebody come to work sick? So we have to think of all those things. We're doing temperature changes, checks here to make sure people, and maybe it's not so much. I mean, we could do the same thing here that we do with our kids when we want to take them, send them to school, and we give them the Tylenol before they leave for school. We've all done it. If you haven't done it, you're not telling the truth. But it just makes people aware of the need to stay home if you're sick, because you realize then, hey, this isn't just me. This is the fact that I'm going to be doing this to my employees. So just think about that and see how you can reinforce that. Everybody needs to reinforce that at work.
Yeah, absolutely. I appreciate the advice. And we now, we were having trouble getting the necessary supplies, but about a week ago or so all the staff that are there now, for instance, we do at least have surgical masks, and we have the other supplies we need. We're actually waiting on maybe finally a delivery of the KN95s to all the foster care agencies around the state over the weekend. I'll believe that when I see it.
You don't need that surgical, the 95 stuff. You really just need the surgical masks unless you're treating people that are positive. So that might give you a little bit of help, that you don't need to go quite that high.
The surgical mask and the facial coverings are a lot more abundant and available than the N95s. The frontline healthcare workers are obviously the ones who are utilizing the N95s. So they're really hard to come by. So
yes, we know. So now that we've gotten supplies in terms of the face masks, we are sharing them and distributing them to our residential group care providers, to our shelter care providers, and to foster parents as necessary and appropriate. And then our other concern, and James and I talked about it a little bit the other day, is really getting adequate financial, housing, food for our caregivers, all sorts of caregivers, and our independent living youth, those youth transitioning out of foster care that are between the ages of 18 and 23. Just like the rest of the population, they are losing their employment. They were not making very much to begin. And so we are continuously trying to figure out ways to support them, our foster parents, our relative caregivers, and the birth parents of children who are now reunited or are under protective supervision in their parents' homes. ChildNet has started to do what it can. We've given a stipend to all of the foster parents in Palm Beach County to get them through between the beginning of this and the first check that they would normally get for room and board. That is a one-time thing. I don't know if we're going to be able to find the funds to do more of that. We're in the process of and planning on doing something similar for the independent living youth. So it's sort of a one-time ability to help them out with some money. But going forward, we are going to need a lot more support around the community for these people who are among clearly our neediest and most at risk. And so any help we can get with that. And the particular thing we spoke about the other day was, for instance, the stimulus checks. For some of our relative caregivers and for some of our birth parents, I worry about their ability on their own to navigate the IRS website and be able to, if they qualify, access that. So any sort of help or support that we can link them to do that sort of thing would be incredibly valuable.
We'll certainly take, especially for the seniors, we can talk to our senior services director to figure out what we can do to perhaps assist there. But I'm kind of taking notes on some of those, the things that you mentioned in terms of supports, and we'll circle back around with you, Larry, to see what we can do to strategically address some of the gaps that you've identified.
Thank you. And the one thing, and again, a positive, which I mentioned to the other day, and I double checked before I got on the call today, with just only a minor blip or two, we've done well with getting all of our students the computers that they need to be participating in distance learning. And those two blips, I think, got worked out. So we're in good shape on that.
Okay, very good. We do have a flyer for the parents who want to access the stimulus checks and how they can prepare, and some resources that they can tap into in order to help with any of the challenges. So I'll share that with you. As one of the flyers is on this presentation, but I'll also email it out to you as well.
That would be great. Thank you very much. So that's pretty much my, for the moment, update.
Thank you. Thank you. So we'll go ahead to you, Robert. If you would like to, you and Patty, you guys can just talk through. I put some things on the screen just as some bullet points of hopefully things that you can touch on, but please don't be limited, feel like you're limited to those things.
Patty, did you want to go ahead and do that piece? Can you hear me clearly?
Yes, we can hear. We can actually hear you now.
Yeah, I switched to Chrome. I think that was the right move.
Very good. Very good.
I mean, I only have very few items, so if you wanted me to go and then Patty can go, it's up to you guys.
Fine.
Okay. Just to recap, kind of on the CPI, the Child Protective Investigation side, we're holding steady with our staffing levels. Majority of our staff, 90+%, are working from home. We've been able to keep, a good 2/3 of the staff still operating out in the field. So we are still responding to calls to our hotline of abuse, neglect, or abandonment, or parent needs assistance. We have seen you look at from January to March, we're seeing like a 10% decrease. But when you really look in March to April, we're talking 30 to 40% decrease in the hotline calls. We're following the CDC guidelines on how to go out and interact with families. So we're using all our PPE that was provided to us, and we're keeping our social distancing. We aren't using video teleconferencing for our actual face-to-face contact. we are using that for maybe follow-up and obviously for some collateral context and things of that nature, but we are still doing our normal investigative activities. We are keeping track of all our exposures to our staff and monitoring those. Our hotline actually has a screening process now for all the reporters that are coming through, and that information is being relayed out to the staff. So we are still referring cases to service providers, to case management. We are still doing removals if necessary. I spoke real briefly to my staff after talking with you yesterday, James. We are seeing an uptick in alcohol use as it relates to domestic violence, but when you're looking at the overall numbers of intakes going down so significantly over the last month, I couldn't really say that there's been an increase in domestic violence. There is an anecdotal note that the cases that we are getting are more serious. We're getting a lot of custody issues and things of that nature as well that unfortunately are related to each parent not wanting to do the social distancing and isolation. So that's a new one on us. Interesting. No issues with regards to domestic violence shelters availability. We had one case that we couldn't get into a shelter, and the advocate was able to get them into a relative. And same thing with another case involving a domestic violence where a law enforcement advocate was able to get them into a shelter. So we are seeing an uptick in lockout staffings, which are staffings and kids that are in the DJJ system that are not picked up from your detention center or a placement. And you guys have any services that you want us to push out to the front lines, please share, and we'll be happy to get them out to the front line.
Okay, we certainly do have some information that we want to push out. And hopefully, if June, I don't see June on as of yet. I don't know if she's on as a panelist, and Doris, maybe that's something you can check on. I also don't see Patty added as a panelist either. So we may have to come back to them if they're just in the regular group. Doris can add them as panelists.
James, Patty is already a panelist.
Okay, I just didn't see her. Okay, I'm sorry about that. All right, so Robert, if you don't have any additional information to add, we can go ahead and hear from Patty and then Jennifer, and then we'll go to June if she's here.
Great, this is Patty. Can you hear me?
Yes, we can.
Great. Well, I appreciate the opportunity to be here, and I wanted to take a few minutes to highlight some of the actions that the Department of Children and Families has taken to support Florida's families in responding to the COVID-19 crisis. One of the first things that we did is the governor waived work requirements for SNAP food assistance and temporary cash assistance recipients. So that means that these individuals that currently do not have to participate in either work or work activities in order to receive those benefits. Those work requirements have been waived right now through the months of March and April. In addition, DCF extended benefits for recertifications for 6 months, so that anyone who was scheduled to be recertified in March, April, or May will now be reviewed 6 months later in September, October, and November. As you may know, the Families First Act passed by Congress required that most people who receive Medicaid in March or who qualify for Medicaid after March will continue to receive benefits throughout the duration of the emergency, even if their eligibility changes. DCF is working with AHCA, the Agency for Healthcare Administration. We're working very closely together to implement all of those changes and ensure that people are able to retain their Medicaid coverage. We are also working with the Department of Agriculture and Consumer Services to help them stand up a new program called Pandemic EBT, or PEBT, which will provide additional food benefits to children who are eligible for free or reduced school lunch. That program is not implemented yet, but is in the works. And next week, as you may have heard, we will launch a statewide online purchasing with SNAP with 2 major retailers, Walmart and Amazon. Those are retailers who are already approved at a federal level to participate online purchasing the SNAP. And so we're bringing them into Florida, and that will start next week. To help, as you can imagine, we've seen an increase in people's trying to access our benefits. And so we have tried to respond to that and expanded our call center hours to now go from Monday to Friday from 7 a.m. to 6 p.m. We've also added weekend hours, Saturday mornings from 8 to 12, and most Sundays from 1 to 5. We do have to bring the call centers down for updates, et cetera, during the evening hours. We are consistently now helping over between 600 and 800 clients additionally fill out applications telephonically each day. We're also working to create additional capacity in our communities and with our ESS workers to process benefits faster. As our volume has increased, we've actually begun processing much quicker and are currently processing benefits at approximately 30,000 a day. Now, I know you specifically wanted to talk about what we call the Max Benefit Waiver. We obtained a waiver from the federal government that allows us to temporarily increase the amount of benefits that SNAP recipients receive to the maximum amount. This has affected almost 1 million SNAP recipients around the state and by increasing their monthly benefit. But it is important to note that not all families were affected. In general, we allocate SNAP benefits based on a formula that takes into account both income and expenses like housing and childcare, and identifies the benefit amount based on family size. Some families already receive the maximum benefits, but others, usually due to income, may receive less than the maximum amount. So when the change that you see on the paper here, which by the way wasn't ours, somebody else prepared it, but it looks like the numbers are all right. The change that shows there that some people will receive it as kind of a substantial increase, but other families who are already at the maximum amount, their benefit will remain the same. Now, I did get a question on this already, that whether somebody who newly applies for SNAP would receive the increased benefits. And the answer to that is yes. We don't distinguish between people who are currently receiving benefits and new recipients. But I will also note that right now, the federal government has limited to states to applying for waivers for 2 months. And so our waiver went into effect in March, so we'll have March and April. So at this moment, we only have the increased benefits available for the months of March and April.
Okay.
So those are our major highlights. One thing I did want to mention, if you are working with clients, we strongly encourage you to direct clients to try to handle most of their questions through their My Access account at the myfamilies.com access website, which is www.myfamilies.com/COVID-19/access SHTML. Because as you can imagine, we are getting huge numbers of phone calls. Last week we had over 700,000 calls. So the more people can do for themselves, the less wait time there will be for the things that people cannot accomplish by themselves by going to their My Access account.
Let me ask you, Patty, at one point, and I'm sure this probably still exists, there were a number of agencies, including ours, that helped complete SNAP applications and things of that nature. Are you still seeing the level of participation due to this virus, or can you talk about that just for a little bit?
Yeah.
Or let me rephrase that question. Is that something that you might be able to utilize some assistance with?
Certainly anything that people can do to help is terrific, and we appreciate. We know that some agencies are not able to do the one-on-one assistance like they previously did because they don't have people coming to their offices. But it is still helpful if people can help clients navigate through the website if they have questions, or answer and provide any assistance that they can. That's certainly appreciated by the department.
Okay, thank you. All right, Jennifer.
Hi there. Okay, so yesterday we had our domestic violence council meeting via Zoom, and Marcia Guthrie offered the opportunity for me to give an update here on domestic violence services that are continuing here in Palm Beach County. You can hear me, right?
Yes, we can hear you.
All right. That's weird being by myself in a room. So we talked with the folks who were on the call yesterday, and AVDA, as a general update, AVDA is still open 24/7. Our hotline is still operational. Our shelter is operating at slightly reduced capacity so that we can a plan for social distancing. We would normally have, could have multiple families in the same bedroom. So we're working on separating folks out. We anticipate the folks that are with us will be with us throughout this pandemic. Although what I found that was nice, didn't expect it, was that there were a few families that were with us that had come towards the end of their time with us. And while I expected them with reduced jobs to potentially need to stay longer or not move it out into their own place, they did move on. So we did have the ability to bring in new families as they call and need it. Our hotline calls, and what we're hearing from folks around the state, is that our hotline calls hours are about consistent with what we normally get. We're hearing from folks around the state that the calls are lower than usual, and we're not experiencing that ourselves. What we are concerned about is that folks are going to be stuck at home with their perpetrators, and they're not going to have access to reach out to us via hotline or phone. They don't have a time away from their abuser to necessarily get on the internet and look for help or resources. Or they potentially just think that everybody is closed and are not reaching out because they're not sure what might still be available. So I've worked with Channel 12 and Channel 5 in the last 2 weeks to make sure that they're getting information out that we're still available for services. The YWCA Harmony House was not at our DV Council meeting yesterday, but through other methods, I know that they're operating in pretty much the same capacity that we are. Both of our centers are still providing outreach services for survivors of domestic violence. If there is we are hearing from the state attorney's office, they were interviewed for the news program as well, that their domestic violence criminal cases are going up and they're experiencing an increase, and victims of domestic violence with a police report within the last 30 days that identifies them as a victim of the domestic violence are eligible for funding under the Victims of Crime Act through the Office of the Attorney General for up to $1,000 to relocate away from their abusive partner. Only certified domestic violence centers can help them apply for that funding. So they would have to come to AVDA or YWCA Harmony House in order, with their police report, we can actually, if they don't have it, we can help them get it in order to apply for those funds. In those circumstances, our outreach staff are meeting face-to-face with survivors because that application requires it to be able to fill it out, get everything signed, and faxed over to the Office of the Attorney General. So with social distancing, with masks, we had a wonderful manager of ours. Her mother made us all cloth masks because we can't get any masks. We're hoping from the Florida Coalition Against Domestic Violence in conjunction with DCF that we understand they're going to be shipping some supplies to us, that we will be able to get those. So we are open for business as usual. And we are making accommodations as necessary in order to meet the needs of the people who are calling on our hotline or for outreach services. And that's, like I said, the same for Harmony House as well. Our child welfare domestic violence advocate is still completely available by phone to support all of the DCF folks and ChildNet folks and Children's Home Society case managers in their efforts to work with families that have domestic violence in open cases. So she's still available by her cell phone and email, which they all have. The victim services, Palm Beach County Victim Services is seeing their hotline calls are still coming in. They're still going they're doing a lot of work by phone as well, if I'm not mistaken. Actually, let me pull up the minutes really quick from that meeting because I just got sent those. And they are still available to provide services, but are doing a lot of remote work with survivors as well. And we had the Palm Beach County Sheriff's Office on the call. They're victim advocates. and they are still going to court with survivors to access injunctions for protection, making sure that they are accompanied into the court proceeding. Safety is still something they're monitoring, with abusers also having to be in court. The court system, while it is not operating at full capacity, is still doing injunctions for protection for victims of domestic violence. And so they're available to help them with that process, as are the other agencies. But that's one of the things PVSO's victim advocates are doing on a pretty regular basis as well. So I can't think of any specific thing that, you know, this is my first time on one of these, so I don't know what else.
No, that's fine. It's a lot of useful information. I just have one follow-up question. You mentioned, I heard you say that the number of calls for domestic violence has gone up for the state, but I don't know if you said locally as well. Do we have?
The state attorney's office here in Palm Beach County is saying that their domestic violence criminal cases are up.
Okay.
COVID-19.
Okay.
Local domestic violence centers, as well as the domestic violence centers throughout the state of Florida, are saying that their hotline calls are either the same or they have decreased.
Okay, that's interesting.
Right. So here's the thing that I think people need to consider is that if a victim of domestic violence is home with their abuser and the neighbor hears the domestic violence, they might call law enforcement and get law enforcement involvement. But that doesn't mean that. So it's gonna take more law enforcement connecting survivors or victims to our services for that to happen. It's more of a coordinated effort, because I think that people's concerns are these places still open? What am I going to do? He's the only one who makes money, you know, and so it's this unknown time. So it's going to take us making sure that the community's pushing out the information, that we're still open, that law enforcement is helping to connect victims to our services, and really pull that all together.
Okay, very good. All right, thank you so very much, Jennifer. We're simply not going to have enough time here to jump into the district's conversation with the school district. So we're going to have to circle back around and hear from the school district on what's happening with the district and how we can support them. I just want to give you a couple of other things so that we can push through this very quickly. We only have another maybe 15 minutes or so. So here's the flyer that I previously referenced. We would like for all of the organizations who are on the call to send this out to your counterparts, to any families that you're serving, to any agencies that you know, so that people can prepare themselves for the stimulus checks. I know that people have already started receiving them. And so I think that will create a sense of urgency for those who have not, because they'll be wondering what they need to do. And so please shoot this out to your contacts, and I think it'll be helpful. And if you go to the Community Services website, there are also some useful links that they can use to access a banking account or budgeting or things of that nature as well. And we're working on the individuals who can file the tax return. So there is on the Community Services website, it does have a link where they can very easily file their own, but we're also working to expand the BITA tax return and hoping to partner with United Way in that effort. And so what I want to do very quickly is to have Taruna, if she's still on, to say a few words about emergency supports that are here. And then I want to jump right to Julie Crefo, because there's always some updates that we can get around what's happening with food, and then we'll hear from any other partners. Just very quick updates, if you will.
Good afternoon. We had a webinar yesterday, and that information is available on our website as well. We provided some additional details to all the programs which are funded through community services to have some eligibility guidelines for the clients, and have some way to include some COVID-19 conditions in there to have some eligibility. So that information is available on our website. We have already emailed that information to all of our providers, but But if you need anything related that service, please go to our website and it will give you all the information. Specifically for our senior services program, we have moved additional 400 clients from the wait list for the meals delivery program. And then we are also working with AAA at this time to add additional clients for the meal distribution. We are also going virtual portal wherever we can. For our Belglade Senior Center, we have started some virtual exercise classes. So that has been a really a fun stuff for seniors to do. In addition, we are making all the reassurance calls. And if there is a senior who needs help or who needs a meal delivery, they can call AAA. Or if they are not able to access AAA site, they can always call our numbers 355-4792, and we can connect them with the AAA services. For homeless program, we have been working very closely with all the partners, and specifically for John Prince Park, we have added 4 days of service for mobile showers, and then throughout the county, we have added 7 hand washing stations. So we have been working very closely with a lot of our partners to assist our clients in distributing the masks, hygiene kits, and giving them the tools they need. For our Ryan White program, there is some additional dollars we just received from HRSA. Those are specifically for Ryan White CARES program. This will be close to $300,000, and these particular dollars doesn't have a requirement for that 75% expenditures in core medical. That has been waived, so that will be really helpful to our clients who has been experiencing hardship because of COVID-19. So all of this information will be available on our website, and we will be sending it out to all of our providers and making sure that the clients are aware of these resources, and then our case managers are there to help them in any way to assist them for any services. That's all I have, James.
Thank you. Thank you very much, Taruna. And yes, we were able to get the contract for Goodwill passed, and we'll be moving forward with opening the facility on Fairgrounds Road, and hopefully doing what we can to address the issues in John Prince Park.
Right. And just to add another thing, we are going to our Board of County Commissioners in month of May. We have been working with a lot of federal dollars and state dollars which are coming through under the CARES Act, and that will help our community for the clients who need the rental and emergency services. So there will be some additional dollars coming to our community. I know there are a lot of clients calling us, and we have been serving through our online Oscars portal. However, at this time, we have a limited dollars, but we are expecting to get some money in month of May or June.
Thank you, Taruna. Julie.
Yes, hi, good afternoon. With hunger relief, we're continuing to work very hard to make sure we're covering as much of the county as we can with the grab and go sites for children and their families. All the information with all those sites, the times, the dates, what meals they're serving, et cetera, can be found at 211 on their website or by calling. That's the most comprehensive place to find the information. The school district's website also shares a lot of information about those locations. We are working very closely with all the pantries, the super pantries, Palm Beach County Food Bank and Palm Beach County, to monitor what the situation is, particularly with the non-perishable foods. We're finding that that's been challenging, so we've put solutions together to address that, and that is being taken care of, but monitored very closely every week, so that we make sure that our most at-risk residents and communities are getting what they need. We're checking with what the closed food pantries to see if any of them are interested or perhaps able to reopen, and coming up with some solutions to help them if they are able to reopen, and if not, other locations in the communities that we've identified and work with by zip code and other data. They're serving more than, I'm looking at the grand totals for everything. If you count the school district, they serve more than 10,000 children during 1 week. The total meals for 3 weeks were over 450,000 meals. We've got other sites that are serving an average of 3,500 meals a week, et cetera. So there's a great need out there, and we're only hearing that it's increasing, and that includes pantries as well, as people are unemployed and facing circumstances they never had before. We're working with Area Agency on Aging to continue to vet their agency pandemic response plan for seniors. And a partnership that we're really working closely with on more and more on a daily basis is the United Farmers Alliance. It's a group of Palm Beach County farmers. They're working on solutions to get product from the farms to at-risk communities in Palm Beach County. They also work with Florida Department of Agriculture and Consumer Services and helping farmers to register on myflorida.com so that their products can be sold to FDACS, which is Florida Department of Agriculture and Consumer Services, and other entities. They are looking to assist the farmers to get those crops out of the fields, keep the folks that do that for them employed, and help the farmers to break even with their product. And again, to get that into the at-risk communities. That's been in conversation for, I guess, a couple of weeks now. They've applied for funding to the COVID Relief Fund, along with obviously many, many others in the community. And this, just want to take this opportunity to remind folks to apply to that. It's on the United Way Palm Beach County website. And if there's other needs in the community, social service needs, please do that. Lastly, and oh, actually there's two more things, James, I hope that's okay. We're working with the local radio stations, Hispanic, Haitian, and then Sugar 99 through a partnership with Children's Services Council. We already have folks that speak the language for those communities and are respected members of those communities that help us get information out related to hunger relief, but we're looking and working on getting that more frequently. Right now we have a slot in May, but we'd like to get something a little bit before that if possible, that we can talk about the programs, what's out there, whether it's WIC or the seniors or SNAP benefits changes and that kind of thing. So that we're working on that. I don't have that scheduled yet, except for the one in May, but I'm hoping to get something sooner. And lastly, we've been hearing some requests from the community, if it's possible, to get formula and baby food through the Break Spot program. So we're checking into that because that does cover 0 to 18. I'm starting to hold some meetings with community partners on that on Monday, so we can figure out how we can help folks get that access to that type of food as well.
Okay, thank you. Thank you. Go ahead.
Thank you, James.
Thank you. Thank you, Julie, for all that you do. Food is just a crazy, I don't know how you do it sometimes, but we really appreciate your efforts and just hanging in there and trying to coordinate this massive task for food. So thank you very much.
Thank you, James. Thanks for the opportunity.
Absolutely. I do want to mention a couple of other things. We know how burdensome this pandemic has been on many families, and mental health is a huge thing. There are a couple of things that Palm Health Foundation and some others are doing. So here's a virtual mixer that you may be interested in. I wanted to make sure that you got that out. The next one is on April the 21st. So please, if you're able to participate in the virtual mixer, here's the information for that. In addition to that, if anyone needs additional mental health support, so typically those who need support for suicide, or what we would refer them to 211, and then they would navigate. But for you as employees or for community members or others who need mental health supports, you can call this number and NAMI will help navigate you. They are very flexible, in terms of pricing and how they operate, especially for those who don't have insurance. So I would encourage you to call here. We're working on getting a hotline that is free. That's something that we envision for this community, especially with some of the mental health challenges that we can anticipate. But I wanted to make sure that you had access to this information as well. And then this is something that we're working on. There are a number of nurses that are available and willing to volunteer. And we know that our kids who were in school at one point had access to nurses and others as well. So if that's a need for anyone or any of U.S. agencies, you can call the EIC at this number and put in a request, and we'll see if we can get those volunteer nurses to work with you. And then I also want to make sure that I point to this legal resource guide. I had an opportunity to kind of peruse through this, and it was very useful. I've even sent it to some of our clients who are worried about getting evicted or what their rights were during this pandemic. And it is a very useful tool that I would encourage each of you to utilize to make sure that you and your clients know what their rights are. So just take this with you as well. And if there's a way to get it to those that you work with, please do. And of course, we're going to try to get Bob or his team members on one of these calls in future weeks, just so that they can share more information about that. I do want to mention that I see Dr. Alonso had to leave, but I do see a couple of other comments around healthcare. I see one about the African Americans reflecting the lack of testing and how that relates to healthcare, the lack of healthcare or access to it. I see questions about the demographics, racial makeup of who's died and what we would expect. And then there's one that is about the information received about SNAP benefits. Can anyone go and apply, or is it for current participants? And I think I can safely answer that one in that anyone should be able to go and apply for benefits from those sites, not just individuals who already have SNAP's benefits. Okay. So are there any other community partners on the line that would like to give a quick update? I think we have maybe a couple more minutes here. Any other partners? If not, then we're going to go ahead and dismiss this call or adjourn this webinar. Remember that you can log on to pbc.gov.com/community services and gain access to this webinar. I thank you guys for participating each and every week. If you have a particular topic that you think is relevant, I would encourage you to email me so that we can maybe explore getting it as a part of our agenda. We will dive into how we can support the school district and our students moving forward. We'll make sure that we send these flyers and information to you so that you can communicate this to the families that you're working with. And with that, I would encourage you to just stay home, stay safe, and we'll see you next week.